Good morning. Today, Kauvery Hospital is inaugurating Thalassemia Daycare Center, and for which Dr. Lawrence B. Faulkner from Italy has been honored as our chief guest for this special occasion. We will be asking few questions to Dr. Faulkner regarding this thalassemia. Good afternoon, Dr. Lawrence. We are very glad to have you here on this wonderful occasion. Actually, we have a lot of questions regarding thalassemia. Not only me, but the public do have. So I'm here to ask you a few questions about thalassemia, and hopefully I should get the right answer about that. So shall we start?
Yes, please. Thank you.
Wonderful. Doctor, can you tell me what is thalassemia? Can you define it?
Yeah. So thalassemia is a genetic disorder, which means it's a disorder which is inherited from the mother and from the father, and it's a disorder in which if one is a healthy carrier, is essentially a normal person. When two healthy carriers meet, then they have 1 in 4 chance of having a child with this severe form of thalassemia, which is called thalassemia major or transfusion-dependent thalassemia. And in that disorder, the body is not able to produce normal red cells, normal so-called adult red cells. And so the problem is then when there is the switch from fetal to adult stem cells, so when the newborn starts to produce mature adult stem cells, that switch cannot happen. And so these children become very, very anemic, normally by age 4, 6, 8 months, and they need and they become so anemic that they need transfusions, and then they normally need transfusion for the rest of their lives, unless they get a definitive cure, which is bone marrow transplantation. And this transfusion normally is given every 3 to 4 weeks, red cell transfusions, yes.
Okay, that's great. So doctor, is it a communicable one? I mean, can it spread from one to other, or what is, that's what I'm asking.
Okay, so communicable is a tricky term in the sense that it is not communicable in the strict sense. It is not infectious. It cannot be transmitted from one person to another, but it is genetic. So it's communicated from the parents to the child, but it's not infectious. So a thalassemia child is not a risk for anybody around him. It's often more the opposite, but so it is, no, it cannot be transmitted like an infection. Yes.
The CanThalassemia is preventable? If so, how?
Yes, thalassemia is preventable. Now, the only way to prevent it, or the most effective theoretically, is that everybody knows whether he's a carrier or not. And so, when you decide about who you're going to marry, if you know you're a thalassemia carrier, ideally, you should not marry another thalassemia carrier. Now, I don't know the exact figure. I would guess that in Tamil Nadu, probably 1 person every 30, 40 is a thalassemia carrier. So it's not very likely that you will meet another thalassemia, that your future wife will be a thalassemia carrier. But that would be the best way, because to have a thalassemia child, both parents have to be carriers, by definition. Now, if both parents are carriers and they are so much in love with each other, they want to marry each other, then they should, whenever the mama gets pregnant, they should go for a test which is called prenatal diagnosis, which can identify if the child is a thalassemic. So statistically, 1 in 4 children that they have will have thalassemia, and in that case, they can consider to interrupt the pregnancy.
So since you have said it is preventable, the next question would be, can it be completely cured?
Yes, it can be completely cured. Nowadays, the only way to completely cure it is a bone marrow transplantation. As I said, the problem with thalassemia is red cell. The machinery that produces red cells is in the bone marrow, so it is possible to substitute the diseased bone marrow with the healthy bone marrow. Often we use a compatible sibling, brother or sister, but now we can also use directly either the mother or the father. Yeah.
Doctor, just to add up on, a child who is having thalassemia, how often the blood has to be transfused?
Yeah, it is a bit variable, but normally it goes between 2 weeks to a month.
And when it is the right time to start the treatment for that particular child?
So, right, as I told you, at least the severe form of thalassemia starts whenever there is this switch from the fetal red cells, the adult red cells, that happens between 4 and 6 months of age. So normally the diagnosis of thalassemia is done, of severe thalassemia is made within the first year of life, often, and that's when they start to get transfused. The problem is that as they get more and more transfusions, iron from the blood accumulates in the body, and that iron can cause a lot of problems. So transfusion begins normally by age 1, but then this iron accumulation can cause problems, and also that needs treatment, and the treatment for the iron accumulation normally starts by age 2. So after they have received those 5 to 10 transfusions, and the doctor can do a lab test, which is called ferritin value, that can tell that now it's time to begin a treatment to remove iron from the body.
Just out of curiosity, I mean, a thalassemic child can have a normal life like any other child? Can it be like that?
Yes. I think nowadays a thalassemic child can have a pretty normal life. If they get good care, safe transfusion, proper chelation, they're followed by doctors that have some interest and some dedication to thalassemia. Even with regular transfusion and chelation therapy, they can have a life expectancy which can be in the 50, 60 years old. Sometimes there is an issue with quality of life. So when they become older, they may have some problems that may affect their development, their heart function, and so sometimes they have chronic pain. So now, because bone marrow transplantation has improved so much, the risks of bone marrow transplantation are probably on average less than the cumulative risk of the disease, even if you get good care. So I think nowadays, even in Europe, in the US, if a child with thalassemia has a compatible sibling, he would probably go for a bone marrow transplant.
That's great, doctor.
Yeah.
Last but not the least, doctor, I have a final question since you have already answered that. The thalassemia child or the person who is having can have a normal family life? Can he have a child on his own? Since you have already explained, just
No, yeah, of course. So this is actually a very important question, of course. So in general, so if a child gets transfused but doesn't get good chelation therapy, good care, this iron can also affect fertility. So these children may not normally go into puberty. They may not have a normal development. However, if they get good care, good chelation, both boys and girls can have a normal development and have children. So in the West, it's not unusual for a lady with thalassemia to have a child. Now, with bone marrow transplantation, because we're still required to give drugs to sort of clear up the bone marrow, those drugs can also actually affect fertility. So one of the drawbacks of bone marrow transplantation is that in approximately 50% of cases, now we're working on ways to decrease this, but there may be an issue with fertility. And this also may depend on age, especially in girls. So I think young children, if they undergo a bone marrow transplant, most of them may still be able to have children, but if you don't go through a bone marrow transplant, you get good regular care, most of the time